And I think Mary Beth has a, okay.
About concept. My favorite subject.
Here.
And I just said enter. Okay, all right. And so my topic of interest, and it has been a topic of interest for a while, is a little twofold, and it's really teaching critical thinking and how do we do that. And there's a lot of different, I think, opinions out there. So kind of the background is patients are getting sicker, so nursing care is a lot more complex. And then, so again, it isn't just, bed baths and all that. It is differential diagnosis. It is anticipation. It is all that, which I believe takes critical thinking. So how do we, can we teach critical thinking? And how do nurse educators teach students how to think critically? So in kind of some research, David Ausbell, who I think is really unknown, really, I think, was the forefather of concept maps. And he identified that students think and use concepts to learn. And that they use concepts to make connections. And the use of concepts to learn happen in three ways. And subsumptive, I don't know if I'm saying that right. That's where the more broad terms are underneath the more specific terms. So it's a little hierarchical. The progressive differentiation is really analytical. I always think of this as like peeling away the orange peel to get to the middle and to the meat. And then the integrative reconciliation is putting it all together, kind of bringing it all to a whole. So Novak and Gowan in 1984 used Ausbell's theory to kind of create really more nursing concept maps. And so there's different concept maps. I didn't put the picture because I'm sure you're familiar. And there's hierarchical and the chronological. And again, this is kind of that subsumptive. It's general to specific. Spider concept maps, they're very easy to configure. The flow chart is very linear, easy to read, not my favorite. And then your systems, and that's all the data elements and shows multiple relationships. And I think that's really, we need to utilize that more in critical care. So I went through and did some literature reviews, and there were three kind of studies that were recent. And in all three studies, what they did was get nursing students, and they used one that didn't use concept maps and a group that did. They pre-tested them. They all scored pretty much identical. However, post-test or after whatever they were teaching when they used the concept maps, the groups that used the concept maps did significantly better in all three. Now, these were experimental studies, so, they have some, they could be argued, but I think it was very telling. So again, I believe concept maps are beneficial for nursing students to connect the dots, to really not think in a linear fashion, but in a broader kind of holistic fashion. And I think just visually, it makes them pull it all together. I think this is a very important way to teach critical thinking skills. It is not just rote memorization, it's brainstorming. I think it helps in studying because when they're looking at a concept map and they're seeing all that, when they go to test, that's in their brain. There is some kind of correlation to mind mapping, which I really believe in. That's how I learn. So, and there are different concept maps can be used depending on the skill level of the student, what is being taught, and the complexity. And then those are my references.
May I ask a question about?
Certainly.
And this is a true question I don't know the answer to.
Mm-hmm.
How does one teach a student to do concept mapping?
How I can only speak to myself. How I did was, I would teach, like, let's say I was teaching respiratory for, advanced med surg. And I would say, okay, and I would just put maybe CHF. and I would have pull students up and what do you know, what nursing diagnosis would go with this? And they would do a little box. And then, give me 3 bullet points on the pathophysiology and then 3 kind of nursing care. So I liked kind of the spider in teaching because it got the students out of their chairs and then they didn't know I was going to do that. So they really had to kind of go, what do I remember? Was I listening? So it kind of helped the students know that at any time I could do this. So they tend to pay attention a little bit more. But it also was discussion. So it wasn't me talking at them. It was let's all talk together. And what I found was a lot of students had some really interesting ideas, and it really opened up, I think, a lot of discussion. So it wasn't teacher student, it was really kind of a group thing without being a group thing, because sometimes you get a little kickback from groups, so I don't want to do a group. So I kind of found that, especially the different pathophysiology. I always use CHF because, they could wheeze and it could be asthma, and how do you know it's CHF and kind of the different ways. So the school I taught at, they actually had there's online concept maps that you just kind of fill in, which I like, but I would make them. And then after that, I would give them a big piece of white paper and say, give me a concept map on these. And we would put it up and discuss it. So that was kind of fun.
So it's an interactive teaching as opposed to here's what you do. It's let's do it together.
Right. And I felt it was, I always kind of struggled with which was the appropriate nursing diagnosis. And that hasn't changed in 30 years. Students still, which one do I pick? Which is the most appropriate? So that kind of helped because I could see it's hard to know their thought process until I actually see it and talk about it. So some of them were a little off, and it's like, okay, what's the most pertinent? And I used to say, what's going to hurt them the most? Start there. I go, it's most important to least important, because they would think, altered tissue perfusion. It's like, well, yes. Let's talk about gas exchange first, So it got that. I think it made, the nursing diagnosis fun. I think all students kind of belabor, it's like, oh, how is this relevant? But it is. And so I think this was a way to help teach them that.
Aurelia, how about will you start us off? We have a list of questions that we're going to go through.
Sure. So tell us briefly what you know about APU and the School of Nursing and what attracted you to the position.
I've worked with people that went to APU and I always have heard very good things about it. Let me see if I can say this right. My husband's cousin, his wife's sister's husband used to work here.
Wow.
So I'll test you on that yet. And it's just
Somebody's husband.
yes, right there. There's your spider. Yeah, there's that concept mount. I really have to be honest with you. I'm attracted to faith-based organizations. And forgive me if I'm a little too political, but I almost feel like it's just not, there's a certain, I think, perceived notion of what Christians are and who we are and what we stand for. And I really, you can't teach nursing care and not bring in God and Christ and all of that, because there's just so much about the body physiology that is godlike. I mean, it isn't just happenstance. It isn't, two little amoebas bursting together. I mean, there is, I think, a miraculous part of our bodies. There was a book I would love students to read. It's called More Than Meets the Eye. I believe that's what it was called. And it was written by a physician. It's like my favorite book because it really breaks down the body and just how that's just a miraculous thing. Mm-hmm. So working in a faith-based organization, being able to bring that into the classroom, sometimes I think because of technology and where I think society has gone, we've really taken the care out of nursing care. And just working in the emergency department, you really struggle with that. So I'd like to, bring the Christ and the caring back into the classroom and not be afraid to talk about it. not to be fearful.
Okay, so can you take a few minutes and give us an overview of both your experience in academia, including any clinical teaching and or graduate, postgraduate training or coursework?
Sure. So I've been a nurse for going on 30 years. I can't believe I'm even saying that. It seems like yesterday. I started out in the pediatric intensive care unit. Ended up being charge nurse. We did transports. And then my friend said, you have an ER personality. You should go to the emergency department. So I wasn't sure if that was a compliment or not.